Hi there and welcome back. This is the place to be if you're searching for some educational tips on how to lead a happy, healthy life. I'm Dr. Chybar-Virgo, a medical doctor and wellness coach. And as a person in the medical field, I have seen a lot of patients who suffer from chronic non-communicable diseases. Some example of these are the common ones are like high blood pressure, high blood sugar, high cholesterol level. And what the chronic means that it's just long term, ongoing, and the non-communicable part means it just can't affect somebody. You can't really like sneeze and then pass it on to someone else. So that's what that little term means. But the reason why I'm bringing it up with you is because it's just really alarming that the number of persons who are suffering from these illnesses. And the WHO, for example, they reported that NCDs, which is short for non-communicable diseases, it says that NCDs account for 74% of deaths worldwide. Now that is a very high percentage. And it's just that the rate at which people are being diagnosed with these illnesses is so scary. But fortunately, most of these diseases can be prevented with healthy lifestyle changes. And some of these I'm going to go through in this video, but there is something to look at first. And that is a disease that can be a risk factor for other NCDs and can even worsen those type of illnesses as well. And that disease I'm talking about is nothing new to us. It is associated with the leading cause of death worldwide. It has claimed the lives of 2.8 million people yearly. What am I talking about? Obesity. Obesity has dramatically burdened the healthcare system. It has burned holes into the pockets of billions of persons because people suffering from obesity have to spending lots of money on trying to improve their health. Maybe because they have the numerous doctor visits to make, or numerous surgeries, numerous medications, and overall, obesity has just reduced the quality of life. And not to mention, as I mentioned before, it can increase the risk for other diseases. The American Heart Association put out a article the other day saying that obesity contributed to up to half of the new diabetes cases in the US. So most times when we hear the term obesity or overweight and having it in like a discussion, the discussion tends to be geared more towards about appearance. But as you can see from what I just spoke about, it does go beyond looks and appeal. It can have harmful effects on your health, your body, and quality of life, and can be quite expensive. So let's talk a little bit about like having a little definition for what this is. So overweight or obesity can be defined as an abnormal or excessive fat accumulation that can impact health. And there are a few keywords I want you to focus on that I just mentioned right there. I mentioned excess fat and not necessarily weight, and you'll see why in a little bit. And I also said excess fat because our bodies do need some type of fat, right? Because it has several benefits, like, it cushions our joints, helps keep us warm and insulated. Also, we need some healthy fats for brain function. So, there are some benefits of having healthy fat. But then the problem really is when they get excess fat accumulating, like especially around the midsection or too much around the organs, that can affect our health. And again, you'll see a little bit through this as I go through this video. This is not a topic that is new to us. We've heard it several times before, and it's going to share a little bit of the trend of what's going on today. Harvard University estimated that about 2 in 3 adults are considered overweight or obese. That's a significant number right there. So more than 1 billion people have obesity, and the thing is that 39 million of them include children. And let me tell you that they too are at risk for the illnesses that I mentioned before, and what I'm going to talk about as well. The different pain, the suffering as well. So as you listen to this video, just bear in mind that age group can be affected too. So, what are some of the risk factors that can cause one to become overweight or obese? Now, there are several factors, and I like to group them more into like things that we can change and things that we cannot change. I'm going to start there with the things that we can't change. So, the first one to look at is like genes, for example. So, genes do play a role, but it doesn't mean it's your destiny. So, genes can contribute to obesity, But if you combine it with like other factors like unhealthy eating habits or an inactive lifestyle, then that does increase the risk for that unwanted weight gain. But there are other risk factors that we cannot change. But what I focus now more really on the factors that we can change, have more control over. And some of those can include like unhealthy eating behaviors or not being physically active. You see, the thing is that when you consume too many calories than we actually burn, so you're eating a certain number of calories and you're not actually using up all those calories, you're not as active. So that tends to cause some of that excess calories to be stored. Then also think about the types of food that you're eating. Is it nutrient rich or nutrient dense foods, or is it more of the fatty, sugary foods that we're having in our diet? So, is it balanced or not? So those are some things to look at when talking about eating habits. Other risk factors for obesity can be like not enough sleep, high amounts of stress levels, for example. Now, the great news is that these lifestyle factors that I mentioned just now are actually things that we can control or actually change. And those tend to play a higher weight of the risk factor of leading to obesity or overweight. So, how can you tell if you're overweight or obese? Several ways to kind of have an idea of where you fall in a category. This is one of the things that's more commonly used called the BMI chart. And it's a nice little estimate to give like whether you're overweight, underweight, or normal weight. And it's called the body mass index chart. But the thing about it is that it doesn't really account for body percentage fat or body percentage muscle or where the fat is distributed. For example, take a look at these two persons right here. Which person here would you say is overweight? So at first glance, you'd probably say person A, right? But based on the BMI chart, they'd probably say that they're both overweight, right? And so you see, it didn't really take into account the percentage muscle or where the fat was distributed. Now, this carries me to the second part, like the waist size. So this now checks the waist size or the excess fat around the midsection, because that can give you a little indicator of health as well, your waist size. So, for persons with their waist size measured more than 35 inches for a woman or more than 40 inches for men, they tend to be at an increased risk for obesity related health problems. So I've had persons where they've said that the weight hasn't changed for the past 5 or 7 years, and so the question to then ask is, even though the weight hasn't changed on the scale, has your clothes changed? Has your pant size changed? So what might be happening is that, so while the number on the scale didn't change, your fat distribution and percentage muscle may have changed a little bit. And the other way to check is the body analysis scan, and it tells like the weight percentage fat, the weight, the muscle percentage, also the visceral fat, as the fat around the organs. This is what I tend to use a lot more because it gives you a better picture of what's going on. So, what illnesses or diseases have been related back to obesity? And can look at it a bit by thinking about where is the excess fat located. So, for example, if someone is suffering from knee pain or back pain or joint pains, or other joint pains, the question that can be asked is, could it be that excess fat is causing too much pressure or strain on those joints? We can also find excess fat deposited like around the arteries. This is where it carries blood and oxygen to other parts of the body, like the brain, for example. And when we have too much, can lead to high cholesterol. Now, that fat deposit can also become so much that it blocks the vessels from the blood from flowing properly, which can then lead to high blood pressure as the body is pumping hard and harder, trying to force blood through the vessels to where it needs to go. And if it can't get to where it needs to go, like to the heart or the brain, this is why it can lead to heart attacks or strokes. Obesity can also cause fertility issues like difficulty getting pregnant, and it can also affect things in the bedroom, like erectile dysfunction, for example, but it can also affect sleep. So you may have heard someone saying that they feel tired even after sleeping for 8 hours, or maybe they keep waking up in the middle of the night, or maybe they snore and they don't feel as refreshed when they wake up. Because sometimes the excess fat around the neck can actually stop the airflow for a little bit. And we already spoke about the weight around the midsection linked to several illnesses, and one of those do include several cancers, like pancreatic cancer, stomach cancer, colon, prostate, ovarian, and I have a list of few on the screen. These are just a few of the diseases that obesity raises the risk factors for. And I really want to just bring these to your attention because I want you to think about it. Like, is there someone that you know who could be suffering from any of these? Excess fat, breathing issues, sleeping issues, high blood pressure, diabetes? Because, for example, sometimes, when somebody says they're having difficulty sleeping, one of the last things that they're thinking about is that the excess weight or excess fat could be the reason that's causing it. And so maybe somebody or you might be having a discussion and they say that, and you could just say, hey, when was the last time you got a checkup? And then they go to their doctor, and then their doctor recognize what's going on and can advise them what to do next. So I've spoken a lot about obesity and different effects it can have on the body, but now I want to talk about some solutions or things that we can do to reduce the risk factors for obesity and the different illnesses. So I already mentioned that there are some things that we cannot change. So let's focus on the things that we can change, right? And I mentioned a few of them that can be done, such as improving eating habits, being more physically active, improving sleep and stress, and seeking help. So just to break it down a little bit. So getting regular checkup, as I mentioned, your doctor is best suited to assess and detect your risk factors early and make recommendations specifically for you. Both lifestyle changes and medication if necessary. Improving eating habits such as like eating a balanced diet with, nutrient-rich foods in the right proportions. And you can check out my video as well if you want to take a look at an idea for what those portions can look like. And also, while including those nutrient-rich foods, also want to just limit the sugary processed or refined foods. Other things as well is to be more physically active. It is recommended around 30 minutes 5 times a week. But of course, the kind of activity you start with does depend on your fitness level, and to start slowly and then gradually increase. But it's always best to reach out to your doctor to find out what is best for you and what intensity that you can manage, especially if you're new to exercise or have underlying illnesses. Other things you can do is to improve stress and sleep. Aiming to get 7 to 8 hours of restful sleep. And this is another video for tips on how to get a better quality sleep. And lastly, I want to mention is choosing an accountability partner. See, having social support from family or accountable partners with similar goals has shown to yield more significant results. I've seen this firsthand and how much this can work. This is one of the main things that my team and I do where we help persons to lose or maintain healthy weight. And a big part of that is providing you with an accountability and support group that helps to make a big difference. And if you'd like to hear more about the group, then just click the link below in the description. I really hope that this video has enlightened you or brought some awareness on the harmful effects that overweight obesity can have on your health and quality of life. And just to remind you that there are ways to prevent or delay these diseases. And so over the next few videos, I'll be going a little bit deeper on the tips I mentioned to help reduce the risk of developing obesity or other NCDs, which includes some weight loss tips as well. So make sure to hit the subscribe button so that you can be notified when the next video is out. So stay tuned, live your best life, happy and healthy.